The perfect case acceptance philosophy is this: tell patients exactly what they need, and then cheerfully give them exactly what they want. The doctor who does this will, over time, achieve perfect case acceptance. Hey, good morning. Unfortunately, it's a lot easier to say that statement. Give patients or tell patients exactly what they need, cheerfully give them exactly what they want. A lot easier to say that than it is to actually live it. Telling patients exactly what they need challenges non-assertive people, non-assertive doctors. They're terrified of telling people exactly what they need because they're afraid those patients will say no and they want to be liked. The other side of that, cheerfully giving people what they want, is an absolute living hell for assertive, controlling people. So this whole concept, even though it sounds good, it sounds right when you hear it, right? It's very counterintuitive. Regardless of whether you're assertive or whether you're non-assertive, it doesn't come naturally. It's a conscious act, and it's something that we need to vector you into as far as where you need to be in this philosophy. Yeah. And where you need to be in this tell them what they want or what they need and give them what they want philosophy. So we're going to work on that today. Let's see here. We got everything organized. We're good. I see Hector and Dennis joining in early. Thanks, guys. Question of the day up there is fill in the blank. My favorite place to visit in the U.S. is. And that's on my mind because I'm getting back started with my tour, which has always been my U.S. tour. It is now my world tour because we're going virtual. I'm not traveling in these places. I'd still love to know where you like to go in the U.S. So please fill out that comment down. Fill out the answer to the question of the day in the comments down below. Again, I'm not traveling right now because of the COVID situation, but I am out on my virtual tour, which means I'm traveling region by region and working with new chiropractors, to evaluate their practice, and then also write up an action plan for them. So if that interests you, reach out to me. I don't have any kind of sales page or that set up right now. Too busy to worry about that. But just reach out to me. I'll kind of explain what that entails, which is basically, again, we do video conference. Give me a video tour of your office, and then I start asking questions and drilling you on what's been going on in your practice before I wrote up an action plan for you. So that's what inspired the question of the day today, is kind of figuring out where your best places in the U.S. Normally I would go visit them, but I'm obviously not able to do that right now. All right, let's get right into it today. So, like I said, we kind of need to vector you into where you need to be in the tell them what they need and give them what they want philosophy. So today I want to introduce what I call the level 5 case acceptance system. Some of you may remember early in the program, I mentioned the different levels of practice success. I've actually had a few people reach out to me and tell me where they were in those levels of success. I've had a few level 5 doctors reach out to me, and it's been very, I don't want to say enlightening. It's stuff I knew, but it confirming, I guess, as far as my the 14 Secrets of High Performance Chiropractors. I interviewed these doctors and found out that they all fit into that as well as kind of seeing that lifestyle, that level 5 lifestyle. So again, this is the level 5 case acceptance system, something you have to build yourself into if you're not quite a level 5 doctor yet. And as you'll soon see, the case acceptance system is not something that's really complex in its overall structure, but each of the 7 steps in the system do become somewhat involved, and we don't have the time or energy to go into that right here. I'm just going to kind of give you an overview. But if you recall from our first discussion about perfect case acceptance, which was 6-7 weeks ago, we said that any system has multiple components, and all of them are essential, and there's a specific sequence for implementation, and that is very, very key. So in the level 5 case presentation system, there are some elements that must be thoroughly understood if you're going to be able to be effective at moving patients to their next step along the patient development continuum. Do you remember that concept? People from pain-based patients all the way to wellness-based patients, and our job is not to move them all the way immediately, but to move them one step along the system. That being your goal, the case acceptance philosophy of tell a patient exactly what they need, but then cheerfully give them exactly what they want will do that for you. But you've got to know where you are at all times. You've got to know where the patient is at all times. So again, big thing I want you to remember is that case acceptance is not the only goal of this level 5 perfect case acceptance system. It sounds like that would, that would be intuitive, right? That if it's perfect case acceptance, our goal is case acceptance. That's not it. Referral intensity is another important objective that goes hand in hand to mastering this whole case acceptance concept. I've always said that the goal of perfect case acceptance is defined as patients coming in, accepting your care recommendations, scheduling your care recommendations, showing up for those visits, paying for those visits, but then also going out and dragging all their friends and families in to predisposed to do the exact same thing. So there's referral intensity involved in this as well, and we want to develop that along the way with perfect case acceptance. So as I said, there's 7 steps to the level 5 systems, and they're as follows. Number 1 is preempts, permission statements, and negotiations. This is typically about referrals or feedback, and this takes place right in the consultation. Second step of the system is the diagnostic presentation. Now, I know you're trying to relate this to what you're already doing, but you're going to see that there's a little bit of a difference here in the diagnostic presentation. We consolidate a few things, but number 2 is the diagnostic presentation. Number 3 is the first close. Now, don't let that term put you off. I've kind of led up to this by saying that this is not going to be a bunch of salesy stuff, but I have to use this term because a close is a part of the case acceptance process. So number 3 is the first close, and again, don't be put off by that word. Number 4 is questions and objections and how you're going to handle them. And again, as I've told you, you can't overcome objections. That's not a thing. You've got to preemptively overcome those objections, which we're going to be talking about. Number 5 is the second close. And again, don't be put off by that term. A close is a much simpler, non-salesy process. Number 6 is making financial arrangements. And number 7 is going to be scheduling treatment. So you got to notice here that from the time the patient calls into the office to the time that they pay and schedule their next visit, that's all considered part of the case development concept, which leads to perfect case acceptance. I also want you to notice that case presentation, or what you might call a report of findings, is included in the diagnostic presentation, step number 2. And it's really only one of the 7 components. I didn't really even mention case presentation, right? Because that's actually included in the diagnostic presentation. Like I said, we combine a few things. It's part of the exam, it's part of the x-ray. Case presentation is kind of an all-in-one thing. I call it the diagnostic presentation, but it's only one of those 7 components that we've talked about. I came to see this case presentation, the case diagnostic presentation, as a place where you really can't win the case, but you can lose it permanently if you're not careful. So everybody who wraps that case presentation, report of findings into one big dog and pony show that they set up with everything they do on day 1, they're betting everything they have on that case presentation. And as I said, you can't win the case there. You can only lose it. So I feel like making it that important and setting it aside is a bad thing to do, and has, again, counterintuitively helps you lose a case. So some of you may have heard, and I know I have this a lot, maybe you've seen some of my videos or heard an interview or something of me where I talk about confrontations and how confrontations represent one of the great barriers to practice success. Well, when I speak of those things, and again, anywhere, whether it's a video or some, when I used to do it on stage, I guess I'd say, or in mastermind groups, it wouldn't be uncommon for someone to come up to me afterwards or reach out to me if it's a video and tell me how much they appreciated the talk and how much they need to get stronger in confrontational encounters. Now, when I hear this, I get this type of feedback. I typically worry that I failed as a communicator. It worries me because it's very typical for non-assertive doctors to tell me that they've been so inspired by my trainings that they're going to go back to their practice and they're really going to get tough with patients. In other words, they're going to quit losing their income from their ineffectiveness and start losing their income from their offensiveness. I talk very often when I talk about confrontation, about confrontational targeting. Again, knowing where you are, knowing where the patient is, and knowing how confrontational you need to be. If you think about non-assertive doctors, they're very ineffective at their presentation. Confrontational targeting will help you to be effective, but also non-offensive all at the same time, and it is offensive. Because again, a non-assertive doctor will be ineffective. They won't move people. An assertive doctor will be offensive. They'll get the patient to nod and smile, but not really get the case that they're looking for. In fact, assertive doctors will come up to me after the exact same presentation, and they'll tell me that they feel like they don't have any problem at all in confrontation. In fact, they'll tell me that they feel like they're very gifted in this area, at getting people to see things their way. And they'll prove this to me by showing me that 75% of the patients verbally agree to care. Notice I say verbally. What they fail to realize is that they're only getting maybe 1, 2, maybe 3 referrals each month. And again, I told you perfect case acceptance doesn't just get you case acceptance, it also gets you referral intensity. So if you're overly confrontational and you're offending people, you might get them to say yes because they've had a chance to listen to your speech, but they're not going to go out and refer their friends and subject them to that same timeshare sales presentation. And again, these offensive doctors don't get the referrals to follow through. They aren't getting, those people aren't getting care. So as I've always said in this whole thing, when this level 5 case acceptance system, those 7 steps have to be balanced. Somewhere between being non-assertive and assertive, we find a very happy medium, which is effective and non-offensive. And that's what we're looking for in this level 5 case acceptance system. So that is the philosophy. Write it down somewhere. Put it on your wall. I've had several clients that I've gone to visit a couple of times, and when I go there the first time, I talk about the philosophy, and I go back the second time, I see it written down somewhere. I've had a few that used it as the screensaver on their computer, and I just see my name, my words there, and it's always kind of fun. But tell patients exactly what they need, and then cheerfully give them exactly what they want. That's the philosophy. Write it down, learn it, live it. You're going to be much better off, and you're going to get perfect case acceptance over a period of time. All right. Let's see who's joined us here again. Answer the questions of the day up above. I always forget. It's always reversed. My favorite place to visit in the U.S. is, put that in the comments down below, please. Tomorrow we've got Referral Mastery coming up, and we're going to be talking about training your staff to say yes. It's always looked at as a bad thing to have yes people around you, but in this situation, I want you to have all yes people in your office. Not yes to you, but saying yes to your patients. That's going to get better referral intensity, help you to generate more referrals in your practice, help you inspire more referrals. So between the preamps and negotiations we just talked about in perfect case acceptance, in training your staff to all be yes people, you're going to get referral mastery, and the practice is going to grow, especially as we come out of this coronavirus issue, which, by the way, just a quick aside, I don't have much time left here, but I feel like we are moving into recovery mode. We've been in kind of survival mode these last 6 to 8 weeks, but I've been telling all my clients it's time to move into recovery mode. It's time to start reaching out to people, welcoming them back into the office, based on your comfort level, obviously. But it's time to start moving. It's time to start getting back up and getting ahead of the curve, because it is turning around and you want to be on people's minds. So just an aside, I feel like we are about to start growing again. Be ready for that. And I will talk to you all tomorrow morning, 8 a.m.